Ever wondered what an abscess is and how it forms? Well, allow me to demystify it for you. An abscess can be best described as a pus-filled bump or pocket created by an infection. Imagine a small fortress the body builds to fight off invading bacteria. This fortress can rise in any part of the body, be it the skin, the teeth, gums, or even within our internal organs. Now, you might be wondering, what exactly is pus? It's not the most pleasant of substances, I admit. Pus is a thick, yellowish fluid, composed of dead white blood cells, bacteria and tissue, the remnants of a fierce battle between our body's defense system and the invading bacteria. The type of abscess and its location determine the symptoms and causes, but we'll dive into that later. Intriguing, isn't it? But how does this infection start and what are its telltale signs? So, what causes an abscess to form in the first place? An abscess is primarily a response to an infection, with bacterial infections being the most common instigator. Imagine a battlefield within your body where your immune system soldiers are fighting off invading bacteria. This war zone is the birthplace of an abscess. When the bacteria manage to infiltrate your body's defenses, they can cause damage to the tissues. Your immune system responds by sending in white blood cells to the infected area. These cells work tirelessly, engulfing and eliminating the bacteria. In the process, they produce pus, a thick yellowish fluid filled with dead white blood cells, bacteria and tissue debris. The accumulation of this pus within a confined space in the body leads to the formation of an abscess. It's essentially a pus-filled pocket, a barricade, if you will, that the body creates to isolate the infection and prevent it from spreading to other areas. The type of abscess that forms and its causes can be influenced by its location within the body. For instance, a skin abscess, also known as a boil, often develops due to a bacterial infection in a hair follicle or oil gland. On the other hand, dental abscesses are usually the result of a bacterial infection in the pulp of a tooth, often brought about by tooth decay or injury. Internal abscesses, those that develop within the body's organs or spaces between organs, can be caused by bacteria or parasites that enter the body through a wound, a surgical incision, or travel through the bloodstream from another part of the body. It's important to understand that while bacteria are usually the culprits, other factors like a weakened immune system, poor hygiene, or pre-existing conditions like diabetes can make one more susceptible to developing an abscess. Now that we know what causes an abscess, let's delve into the symptoms it presents. How would you know if you have an abscess? Well, your body has its own way of raising the red flag for an abscess, and these alerts come in the form of symptoms. Let's begin with skin abscesses. If you have a skin abscess, the affected area may show signs of redness. This redness is a result of inflammation, your body's response to foreign invaders such as bacteria. The area may also swell up, creating a palpable lump that could be tender to touch. Swelling is a hallmark of an abscess, as it is caused by the buildup of pus, a thick yellowish fluid made up of dead white blood cells, bacteria and tissue. Warmth is another sign, which you might feel if you gently place your hand over the swelling. This warmth is due to increased blood flow to the area as your body attempts to fight off the infection. And then there's pain. Pain is your body's way of saying, hey, something's not right here. The severity of the pain can range from mild to excruciating, depending on the size and location of the abscess. Now, let's move on to tooth abscesses. If you have a tooth abscess, you might experience an aching sensation in the bone near the infected tooth. This is because the infection has reached the innermost part of the tooth, causing inflammation and pressure that results in pain. The pain might intensify when you bite down or when you consume hot or cold foods and drinks. Lastly, we have internal abscesses. These can be trickier to spot as they are hidden inside your body. However, common symptoms include fever, discomfort in the area of the abscess, and loss of appetite. Fever is your body's way of trying to kill off the infection, while discomfort and loss of appetite are your body's responses to the internal inflammation and infection. Sounds unpleasant, doesn't it? But don't worry, abscesses can be diagnosed and treated. And remember, the sooner you recognize these symptoms and seek medical attention, the better your chances of a quick recovery. How are abscesses diagnosed, you may wonder? Well, it's not as complicated as it might seem. The process of diagnosing an abscess typically begins when you visit a healthcare provider with symptoms that suggest an infection. Your healthcare provider would first conduct a thorough physical examination. This step is crucial because abscesses can present themselves in different ways depending on their location. For instance, a skin abscess might appear as a swollen red and warm bump, while an internal abscess may not be visible but can cause discomfort or a fever. While physical examination is a key component, it doesn't stop there. Your healthcare provider will also delve into your medical history. They'll ask you questions about your symptoms, their duration, and any potential exposure to infections. This step helps to rule out other conditions that might mimic the symptoms of an abscess. Now let's talk about how providers determine the type of abscess and its location during the diagnostic process. The type of abscess is typically determined based on the symptoms you present. For example, a toothache might suggest a dental abscess, while abdominal discomfort could indicate an internal abscess. As for the location, it's usually identified through the physical examination. For instance, a skin abscess would be visible on your body, while other types of abscesses might require additional diagnostic tools. In some cases, your healthcare provider might order tests such as an ultrasound, kinetic scan, or MRI to get a better view of what's happening inside your body. Remember though, each case of abscess is unique. The diagnosis process may vary based on your individual symptoms and medical history. The most important thing is to seek medical attention as soon as you suspect an abscess. Early diagnosis can lead to more effective treatment and prevent complications. Once an abscess is diagnosed, it's time for treatment. And that's what we'll discuss in the next scene. Stay tuned. So, how are abscesses treated? Treatment of an abscess primarily involves draining the pus that has accumulated. This might sound a bit unpleasant, but it's a crucial step to help your body get rid of the infection. When we talk about small abscesses, they can often be treated at home with something as simple as warm compresses. These help to increase blood circulation in the area, which can help the abscess to open up and drain naturally. It's a gentle process, but it can be quite effective for these smaller cases. However, when it comes to larger abscesses, this is where medical intervention generally becomes necessary. Healthcare professionals may need to perform a procedure called an incision and drainage, which, as the name suggests, involves making a small cut in the abscess to let the pus out. This is usually done under local anesthesia, so while it might sound a bit daunting, it's typically a painless process. Tooth abscesses present their own unique challenges. They often require dental treatment, which could mean anything from a root canal to extract the infected tooth, depending on the severity of the infection and the condition of the tooth. Internal abscesses are a bit more complex. These are abscesses that form inside the body, perhaps in organs like the liver or lungs. In these instances, drainage might require more invasive methods, such as surgery, or the use of a long needle guided by an ultrasound or CT scan. This is definitely not something to try at home, folks. Regardless of the type or size of the abscess, it's important to remember that antibiotics may also be part of the treatment plan, especially if the infection has spread or there's a risk it might. Remember, most abscesses require medical attention and treatment, as they do not resolve on their own. So, if you suspect you have an abscess, don't hesitate to seek professional help. It's always better to be safe than sorry. Abscesses, though common, should not be taken lightly. They're a clear sign that your body is battling an infection and needs your attention. Remember, abscesses are not just about discomfort or pain. If left untreated, they can lead to serious complications such as the spread of the infection to surrounding tissues and even the bloodstream, a condition known as sepsis, which can be life-threatening. Your body is a complex machine, and like any machine, it sends signals when something is amiss. An abscess is one such signal. It's crucial to heed these signals and take appropriate action. Never attempt to self-diagnose or treat an abscess at home. What may seem like a simple boil could be a deeper problem, and improper handling can worsen the situation. So let's keep our bodies in check and maintain a proactive approach to health. It's always better to err on the side of caution. After all, health isn't just about the absence of disease, but also about the presence of well-being. Stay aware, stay healthy, If you suspect an abscess, seek medical help immediately.